Dr. Sahin is Assistant Professor of Medicine at the University of Florida in the Division of Oncology. He specializes in GI cancers. Welcome, Dr. Sahin.
Thank you very much, Avery, for the introduction.
No, thank you for joining us.
So let me share my screen. Allison, I think, okay, so now I can share, I believe. Okay. Can you see my screen if you can confirm?
Yes, I can.
Perfect. Okay. Hello everyone. I'm Ilyas Shaheen, as an assistant professor in medical oncology at the University of Florida. So I'm here to represent our program as Dr. Zarimpar, our transplant surgeon who was originally scheduled to give this talk, couldn't make it. My expertise lies in liver cancer, both in clinical practice and research, and I have witnessed remarkable advancement in our understanding of this complex disease. So many of you patients and their families are joining us today as our days revolve around these complexities of basic translation and clinical research, as well as the clinic. It is for you and for them that we are dedicated to studying liver cancer, aiming to find improved treatments and ultimately a cure. Today, we will explore a bit through the recent advancing in liver cancer research. By the end of this session, I hope to provide you with a better understanding of the exciting breakthroughs that have been achieved, their implications for patients, and glimpse into the promising future of liver cancer treatments. So we understand the fears, the hopes, and the questions that come with a cancer diagnosis, and it's our aim to bridge the gap between the research and your daily lives, ensuring that you feel informed, empowered, and then hopeful about the progress being made. So let's start by understanding the magnitude of liver cancer. The graph here, you can see, it shows the incidence rates over the years. It's a pressing health concern with significant impact of patients and their families. And the journey towards finding better treatments and ultimately a cure is an ongoing battle and fueled by extensive research. So current standard treatment for liver cancer includes surgery, transplantation, systemic therapy, and radiation. And the treatment depends on factors such as stage and the location of the cancer, the patient condition, and any other health issues that patient might have. So while this treatment can be effective, they also come with challenges. The side effects can be severe, and not all patients respond well to these treatments. This reality drives the relentless pursuit of the better, more targeted treatments through research. Let's talk about the systemic therapy for a moment. Before 2007, so there wasn't any effective treatment that could make patients with advanced HCC live longer. So then targeted therapies like sorafenib started to help. And after that, more drugs came along, but also many failures. You can see some of the major trials that have been conducted for HCC over years. And most recently, immunotherapies have been shown even more promise. Now, they are the preferred first treatments, especially for patients who can't have surgery. And right now, there are lots of ongoing clinical trials testing different combinations of treatments. And we are hopeful that they will lead to even better results. Finding better treatments can be tough, and we have to deal with issues like drug resistance, late diagnosis, underlying liver disease such as cirrhosis, and limited treatment options. But each of these challenges also present an opportunity for discovery and innovation. So we do have some drugs and drug combination actually have proven effective in overcoming these obstacles. So to overcome these challenges, we rely on solid scientific research. It's through research that we unveil new knowledge and develop better diagnostic tools and discover new treatments. So each breakthrough, no matter how small, brings a hope. It brings us one step closer to improving the lives of patients and their families. And indeed, recent years, we have witnessed remarkable breakthroughs. And from the understand the genetic makeup of liver cancers to the new drugs that target cells more precisely, the landscape of liver cancer treatment is gradually changing for the better. So from on our list is the advancement in targeted therapies. Unlike traditional chemotherapies, targeted therapies aim at specific molecular changes in cancer cells. And one such drug is sorafenib, was approved in 2007, as I mentioned earlier, and it was the only standard of care until a few years ago. So when you examine this complex table displaying like numerous target therapy trials in HCC, it took us like 10 years to discover another drug, a very similar one called regorafenib, that was approved as a second-line treatment. And this drug was meant to be used in patients who couldn't tolerate the side effects of sorafenib. And the following year, lenvatinib was approved based on a study that showed it was just as good as sorafenib in treating HCCs. Building on recent discoveries, refinement, and development of target therapies, so now we are having more options for our patients. And these target therapies, they aim to target specific molecular changes in liver cancer cells while sparing healthy cells, minimizing side effects, and improving treatment efficacy. So new drugs targeting molecular pathways are in the pipeline, including inhibitors of other drivers of tumor growth, growth activation, and generation of blood vessels to tumors. These therapies promise to be more effective and with fewer side effects, and painting hopeful picture for liver cancer treatment in the near future. And a combination of targeted therapies are also being tried in this context. Next, let's talk about immunotherapies. I'm pretty sure most of you heard about immunotherapies, and these treatments, they have transformed cancer treatments. And by boosting body's own immune system, immunotherapies like checkpoint inhibitors have shown promise in treating liver cancers. And drugs like atezolizumab, durvalumab, nivolumab, or pembrolizumab. So these are breaking new ground by empowering our immune system to recognize and combat liver cancer cells. This table lists some significant trials of immunotherapies. Growth of immunotherapies represent a big change in how we treat liver cancer, offering new possibilities and hope for patients. And the development and progress of immunotherapies, which activate our body's immune system to fight cancer, nowadays is a major trend. But of course, we don't stop here. So the journey of immunotherapy is still ongoing, and researchers are looking into newer agents and combination therapies to enhance the immune response against liver cancer. So the potential of immunotherapies to improve liver cancer treatment is huge, and their effectiveness can be further enhanced by combining them with targeted therapies. And there are numerous clinical trials, and I didn't even include all of them here, but they're currently in progress, and it wouldn't be a surprise to hear good news about HCC treatment anytime, and this could potentially result in new FDA approvals. So example, like this paper, for example, just published yesterday in Lancet, so you can see the date, October 20th. So in this paper, so people who are at high risk of liver cancer coming back after surgery had better results when they received immunotherapy, in this case, atezolizumab, along with the targeted treatment, bevacizumab. And when they compare to those who didn't take this medicine and were just watched carefully. So this study, the name of the trial is Embrace 050, is the first big study to show that this treatment might work for liver cancer after surgery. But of course, we need to watch these patients for a longer time to make sure it's safe and keeps working well. So this was just an example just from yesterday, but hopefully we'll hear better news, in coming weeks, months, and years. There are other new avenues being tried, especially with combination therapy. NCI National Clinical Trials Network is currently supporting 2 ongoing clinical trials of radiation therapy for people with liver cancer that cannot be removed by surgery. So one trial is actually comparing proton therapy to standard proton therapy for people with HCC, which cannot be removed by surgery. And proton therapy is a new kind of radiation therapy that may cause less harm to healthy tissues. And people who have liver cancer and another liver disease might be able to tolerate the effect of proton therapy more than those of standard, photon therapy. And the other trial is testing the combination of targeted therapy, sorafenib, with a type of radiation called stereotactic radiation therapy. And this approach uses spatial equipment to position to the patient and precisely delivering radiation directly to the tumor, which may cause less harm to the rest of the body. And the combination will be compared to sorafenib on its own. The field of genetic and molecular profiling is opening new possibilities. And when we understand the genetic characteristic of liver tumors, we can customize treatments for each patient. So this personalized approach is leading the way in precision medicine, aiming to provide the right treatment to the right patient at the right time. So in near future, we are anticipating we will witness how personalized treatments significantly improve treatment results. And the era of personalized medicine is on the horizon and promising more effective and less harmful treatments for liver cancer patients. Genetic testing, precision medicine, these are gaining popularity by understanding the genetic makeup of tumors, researchers and doctors. So we will create their treatment plans to fit each patient and making treatments more effective and less harmful. So one fascinating form of personalized therapy is CAR T cell treatment. And CAR T stands for the chimeric antigen receptor T cells, and it's a groundbreaking way to treat cancer. And in CAR T therapy, scientists modify of a patient's T cells or their own immune cells to make them better at recognizing and fighting cancer cells. And they do this by creating special fusion protein called CAR that combines part of a T cell receptor with an antigen binding part and some extra activation parts. This spatial design lets CAR T cells overcome some of the tricks cancer cells use to hide from the immune system. So another exciting technology is CRISPR, and these are pictures from our paper, which is currently under review. So this technology is a revolutionary genetic tool that allows precise editing of DNA, offering potential to modify genes for various purposes, from treating genetic disease to advancing the biotechnology. And researchers might concentrate on developing CRISPR engineered adaptive T cells immunotherapies for HCC. This is because actually there are studies shown very encouraging results in early stages, especially preclinical studies. And these treatments are more likely to be used in real patient care compared to CRISPR methods that directly attack the tumor cells. And there are some ongoing studies actually for HCC in progress. And as you can see a couple of them from the table here, this picture. So another trend in HCC research is a global collaboration, and this is very, very important. So research initiatives that involve collaboration on a worldwide scale are creating a culture of shared knowledge and speeding up discoveries. These collaborations are breaking down barriers and bringing together teams with different areas of expertise to address liver cancer from various angles. And you can see, for example, different etiology for HCC in different countries. Asian countries more like for hepatitis, but countries like United States or European countries, we see more like alcoholic cirrhotic patients or NASH. Basically, these are NASH cirrhosis, and then the other etiology, which might be different from different parts of the world. So that's why it's very important to collaborate and then to work together in this disease. And global collaborative efforts will keep driving faster discoveries, and by breaking down these barriers and encouraging shared knowledge. So this collaboration will speed up the process of turning research findings into clinical practice. And this is happening. So we can see that. I think that's very promising and very exciting times for the liver cancer research. So finally, one area currently showing promise in finding therapies for many diseases, including HCC, is the application of artificial intelligence, or AI, and machine learnings. These technologies can analyze extensive data sets to help identify new drug targets, predict treatment responses, and improve treatment plans. And this marks the beginning of a new era in personalized medicine. And so in this presentation, so we have quickly gone over the latest discoveries very, very briefly and what's happening now and what's on the horizon in liver cancer research. And our journey tells a story, actually, never giving up, generating new ideas and holding on to hope. And the progress in the liver cancer research demonstrates the intelligence and strength of the liver cancer community. So each one of you, whether you're a patient, so caregiver, family member, researcher, or medical professional, plays a very crucial role in this story. And your questions, experiences, and advocacy give energy to the progress in liver cancer research. And as we continue to learn about liver cancer, remember that you are not alone in this journey. So together, we'll make a strong force against the liver cancer. And your presence here today, it's very, very important. I'm so happy you joined here today. but your search for knowledge and your commitment to, being part of the solution represent a collective determination, to fight with the liver cancer. Let's keep advocating for liver cancer research, supporting each other, and imagining a future, and hopefully where liver cancer is going to be just our part of like medical history, and we don't have to deal with this anymore. So, but thank you for your time and your curiosity and your dedication to a cause that unite us all here. And here's an incredible journal ahead and limitless possibilities I offer. And then thank you much for the opportunity again to talk to today.
Thank you so much, Dr. Sahin. That was very informative.
Thank you.
We will now have Dr. Jones Pauly, Senior Fellow and Committee Member from Houston Methodist, to moderate the Q&A. And remember, if you have questions, please post them in the Q&A.
Good morning. Can you hear me all right? Okay, great. So it looks like we have a couple of questions here that are more concerned with treatment options. So the first question is radioembolization recommended in late stage of HCC?
So typically radioembolization, so when we say when we have patients like locally advanced, especially patients, because if patient has metastasis, like typically we don't recommend this treatment, but if patient has locally advanced disease, meaning patient is not surgical candidate or transplant candidate, so sometimes we offer radioembolization and or radiation. This can be, but usually we discuss this case in tumor board with a multidisciplinary approach, like surgeons, radiation oncology, radiologists, and oncologists, and then we decide, together which treatment is the best option for that patient. Because sometimes radioembolization can be used just as a bridge for the transplant. So that's why it's also another, it really depends on the patient, but I wouldn't call this like, for example, radioembolization, we wouldn't offer it for our patient if they have, let's say, stage 4 disease, typically. If they have but if it's a locally advanced, meaning it's in the liver, but patient cannot go to surgery, it can be an option for some of patients.
Right.
I don't know if this answers the questions.
That seems to have addressed it. And I think the second question you actually answered as well, but I'll go ahead and repeat the question. What benefits, if any, would I think this means stage 4 patient get from radioembolization? We kind of already mentioned that, once it's beyond or outside of the liver.
Exactly, because radioembolization, so for us, like it's a local treatment, because when your cancer is beyond the liver, so typically you need like systemic treatment, which should fight with the cancers wherever it is in the body. That's why radioembolization won't be enough, because that's a local treatment.
Got it. This is a question concerning maybe potential genetic connection between this patient or patient's husband's death after contracting or being diagnosed with cholangiocarcinoma about 1.5 years ago, and her daughter's recent HCC diagnosis. Any known genetic connection there?
Not much, but for what we recommend to our patients, typically nowadays, like we do, next-gen sequencing for our patients. And I think if there's any concerns, I would recommend to reach out to your oncologist, because typically we do also genetic counseling for our patient typically, and then just to, to address their concerns. And definitely, and then these tests nowadays, these are not really expensive tests. 10 years ago, it was very, very expensive, but nowadays, so these are really, $100, sometimes even like free insurance covers. It can be done easily, and then, genetic counseling can address those concerns very easily.
Right. The next question is, technically, does an oncologist try Lenvima before Cabometyx? My Lenvima stopped working, now starting Cabometyx. So maybe this is a second opinion of sorts.
Yeah, so what I would say is like, of course, when we talk about here, we didn't go to details, because HCC treatments, typically immunotherapies and target treatments, there are multiple target treatments. We go each case one by one, because but preferred regimens are immunotherapies, but sometimes patient may not be candidate for immunotherapy for different reasons, maybe for underlying disease, or they have contraindications. But if they fail one treatment, so we always look at the other options, including clinical trials. And then I also recommend my patient to look at also for clinical trials if available, because there are many ongoing clinical trials as well. But in terms of Lenvima, sorafenib, there are other cabozantinib, like regorafenib, there are other treatments options. we switch them, like if one of them fails to another one, but and again, each cases are different. But so definitely there are options, including clinical trials.
Yes, everything is highly individualized as well.
Exactly. And it's going to become more individualized in like precision medicine. Yeah.
Right. Question 5. What advice or suggested treatment / prognosis when the disease is advanced to bone metastasis?
Great question. So bone metastasis is not common for HCC, but it can be seen actually. So we did have like recently we published a study for HCC with bone metastasis. So we know like when it's in the bones, like that's like usually that's more concerning to us, but the treatment doesn't really change when you have a bone metastasis, like stage 4, regardless of where the cancer is in the bones or in the lungs, pretty much the same treatment. But it sometimes depends on the bone metastasis. Radiation might be an option also. If it's not like diffuse bony metastasis, if it's like local, radiation also can help. That's why, again, this treatment also can be discussed with an oncologist and radiation oncologist to see if the radiation would give additional benefit for those patients.
Yeah, oftentimes at our institution, we have a multidisciplinary discussion that involves the patient, including their goals of therapy,
Exactly.
if they want to pursue therapy. So it's really it's going to be different for each patient.
Patients, yeah. Mm-hmm.
Question 6. Have you had any experience with a newer treatment called Edison, which seems to involve an ultrasound from the University of Michigan and histotripsy?
So I don't know the details about that treatment, but I know like there are like like again there are many trials are trying different approaches, but at least it's not anything approved yet, or it's not like shown the clinical really benefit that we can suggest patient right now, to my knowledge. Yeah.
Okay, the next question is, keeping cancer aside, how well do emerging drugs in use mitigate fibrosis in the liver?
So that's a great question. I don't know. I don't think we know the answer, because now like actually there are new drugs, like there are a couple new papers fighting with the fibrosis, because like now I think nobody knows. Now I think it will be very interesting to see like treatment for fibrosis combined with these treatments, if it's going to have a better outcome for liver cancer patients. That's a very important question. I'm pretty sure we are going to address those with like coming clinical trials, but we don't know the answer yet.
That's the key question, I think.
Actually, I was asking these questions like
Yeah.
a couple of months ago, like in different platforms. And I'm pretty sure there will be studies on that, because now we have some promising drugs for fibrosis. That's why I think it will be very important to address, because fibrosis, we know it can change the microenvironment, and probably it can affect the treatment response to immunotherapy. For example, patients, especially in the United States, because we have usually NASH like backgrounds, more coming. And we know NASH people, usually immunotherapy response is not really great. So that's why fibrosis might be one of the reasons. If you target fibrosis, you may get better results. But again, these are all hypothetical, so we need to test them.
Sure. If you have a stage 3 HCC that's non-operative, is there anything that can help?
Yeah, that's a great question. That's why like these cases really discussed in like a multidisciplinary tumor board, because the question would be, for example, radioembolization, any treatment, or like, we have ongoing clinical trials, radioembolization, even like immunotherapy, like if we can downstage, and then maybe patient can go to surgery then. So, but again, it's going to be, each case should be discussed, but again, it might be possible.
Right. Okay, this one is a little bit longer, bear with me.
Sure.
He says, thank you for this wonderful talk, Dr. Sahin. My father died after a short battle with stage 4 HCC in says 2024, so recently, I'm assuming. He had a 20-year history of type 2 diabetes, saw the ADA released guidelines to increase screening for liver disease in individuals with diabetes. Do you know what efforts are underway to increase screening in this population of patients? He did not have NAFLD or NASH.
Okay, so yeah, so that's like that's a great question, because they're like especially with the diabetes, like as like there are many cancers types that can be related metabolically. So There is no current guidelines to spatial screening for those patients, but that's a great question. We know there are studies ongoing to try to address this, but as of now, we don't have any current recommendation to tell if you have diabetes, for example, or, like just go screen for HCC. Unfortunately, we don't have that. But what I would say is like, controlling diabetes, if you have diabetes, like, or screening for diabetes is probably more important. And then, weight loss and then exercise, these can be like preventive methods that you can try to decrease your, chance of getting HCC. But as of now, there's no really currently, recommendation for those, diabetic patients to do screening for HCCs.
Right. I think that concludes our questions.
Perfect. Thank you very much. And sorry for the patient's loss. Of course, this is a really tough cancer to deal with. Yeah. Thank you very much, Michelle.
Thank you.
Thank you so much, Dr. Sahin, and thank you all for the incredible questions. That was very informative information.